Hi, my name is Lovely Laban and I am the Aesthetic Nurse Practitioner at Skin by Lovely. This is Tana, and today we're going to be doing a Mini-UpLift, which is something that we do it's full face rejuvenation involving Botox, Dysport, and then a dermal filler. Today we're using Dysport and we're using Juvederm. Okay, the first step is if you actually zoom in on her face, you can see she actually grinds her teeth at night. So she has a little wideness on the side, and we're going to look to narrow that just a little bit and actually widen her upper face a little bit. So my first step is to inject Dysport into her masseter muscle. So what I'm going to have her do is clench down, bite down for me, and I can feel it all along here, the lower mandible. And I'm injecting the Dysport right now. Next step is the neck lift, and another name is the Nefertiti neck lift. What it actually does is it helps this skin kind of tuck in under the jawline and gives patients a tighter jaw. So flex your kind of neck for me, bite down really hard. And you can see as she does this, this area kind of widens. So our target muscle is basically the upper muscles of the neck and the lower muscles of the face. And I'm just going to follow her jawline all the way down to this depressor muscle here. Next step is injecting the glabellar complex up here. We're actually going to use Botox in this area just to open up the space here and to actually elevate her eyebrows. Turn towards me. Furrow your brow really hard for me. Beautiful, and relax. Gorgeous. You can relax. So the next step is, if you look straight ahead here, Tana, you can see she has a little bit of a depression in this area. This is called the pre-jowl sulcus. So once again, our goal is to give her a really streamlined, tight-looking jaw. And we know with the Dysport, this will tuck under. With a little bit of filler, this will actually smooth in. Then I'll be filling her cheeks a little bit and her eyebrows, just to give the whole effect of volume in the upper face and narrowing in the lower. Breathe out. Keep breathing. So we finished with the lower face, and you can see the corners of her mouth are actually coming horizontal. They're no longer coming down. This will improve even more over the next couple days as the Dysport kicks in. My next step with the filler is actually, even though she has beautiful cheekbones, I'm just going to do, there's a slight depression here and here, and a little here. So I'm just going to fill in along this whole area to kind of bring everything back. She also has some flattening of her brow bone here, so I'm going to add a little volume there. And that will be it. Turn this way. Good, and chin up just a little bit. Take a big breath in and let it all out. Beautiful. So now I'm just finishing up. You can see that I've done some volume in her cheeks. Just to lift kind of the areas of depression. She does not want to do her under eyes today, but normally I would be doing a little bit in the tear trough area also. So we kind of filled in back here, and so it gives this illusion when you're looking at her face that her face is wider in the top than the bottom. And the narrowing of her jaw will take place over the next month, so we'll be sure and get an after picture in a month when the masseter muscle has actually come down. Next step we're going to do is a little bit of volumizing in the eyebrow. So chin up for me. Okay, so we're all finished. Just to kind of debrief and explain what we did today. We used 4 syringes of filler. We probably could have used 5 if we had done her under eyes, but we were being more budget conscious. We also used quite a bit of Dysport, over 200 units. So what we're going to do is we're going to see Tana back in about a month to a month and a half and kind of check her out at that point. We'll take some after pictures and be sure and post those so you can see. But looking at her right now, you can see basically that she has more volume down here. Her cheeks have kind of lifted her face overall. She is going to have a little bruise there, so disregard that swelling. But you can see her eyebrows look lifted already just with a little bit of filler. When her Dysport kicks in, everything will look more lifted. Her jawline will also look more defined. And that's it. You were a great patient.
Thank you. You're a great person. Great injector.
Thank you.